menopause? Why has it become supposedly such a big deal? I don't know, 20, 30 years ago, granted, I had no interest in such things, but nobody ever spoke about menopause. It was like an embarrassment, you know, like your mother sort of dealt with it and nobody spoke about it, it was never. Now it's like, it's all over the internet and the TV, and you can't stop hearing about aspects of menopause. Why? It's because we boomers, and I'm the tail end of the boomers, have hit our hormonal decline. We're there. So the age wave that moved through the 60s and free love, and then started to have kids and minivans and preschools, and then they started to have the kids grow up. Those people, that's us, are now hitting hormonal decline. Male menopause, female menopause, there's the bulk of us, and there is something you can do about it. This is how you feel. If not now, if not, you either had it or it's coming soon to a theatre near you. Every woman will get to some extent or another. Some will not be bothered by it, by hot flashes, some will. But this is the primary driver of menopause management. Other things that will come, and thank you to Suzanne Summers for coining the 7 dwarves of menopause, and they are itchy, bitchy, sweaty, sleepy, bloated, forgetful, yeah, and psycho. It used to be and dried up, but you know, we don't like to talk about those, the 7th dwarf, but the other honorary. But the bottom line is that estrogen deficiency, the decline in estrogen, the decline in progesterone, the decline in testosterone affects almost every organ and every tissue in the body. Every single one, to a greater or lesser extent. So, from being forgetful to being irritable to being angry to not concentrating to having menofog or brain fog, they're all worsened. To having thinning skin and thinning bones and osteoporosis and accumulating fat, the whole shebang is in some ways affected by the change in hormones. Some for better, most for worse. So, just in case you thought, well, I'll tough it out and I'll be there. A certain percentage of women will have hot flushes to their grave, even if it's at 80 or 90. If they did a survey, women 29 to 82 years old, 500 of them, and look at that, coming out to 18, 20 years after menopause, there are still some women getting hot flushes. Most have their hot flushes between 2 and 8 years post-menopause. That's where the most concentrated time. But a certain outliers will have it all the way. So menopause may haunt you for a long, long time. Either way, this is the zenith. And the average age of menopause be 47. The range is 40 to 57. So you're looking at between, for average woman, 47 to 55 of literal hell. So why is this happening? What's happening here? If you look, the purple is the estrogen. The amber dots is the progesterone. The progesterone is the fertility years. That's the first day. When you're fertile and you can naturally have babies. Of course, you can have babies out to here with certain help. But the natural years, they're there. They're happening. They came up. Perimenopause. That period where the periods are still there, you haven't quite given up. It's only when it's a year after the last period that's menopause. Until then it's perimenopause. The estrogen is still carrying along and the progesterone is dying and going down. The sleep gets worse, the anxiety builds up, the palpitations happen, a whole bunch of things happen. There's no progesterone to balance the estrogen. It's what some people call estrogen dominant. And that has a whole bunch of different leading side effects and others. And that's what drives a lot of women to their doctors, family doctors and gynecologists because of the bleeding problems. Then you get the menopausal period, some people still call it perimenopause, and the estrogen starts to go wild and wacky and shooting all around. And they think that this is where the hot flashes start to happen. And then finally, the ovaries die, and you're left with no progesterone and a bit of estrogen. And where does that estrogen come from? The adrenals. The adrenal gland produces DHEA, and the DHEA converts into half into estrogen, half into testosterone. And you still got some. Why weren't the adrenals producing it here? Because it didn't have to know it had to. Right? Only then does it turn on better and
What turns it on?
the lack of estrogen there turns on the adrenals to produce more. Some people's adrenals don't turn on, some do, some get tired, some have what's called adrenal fatigue, adrenal overload, different terms. Does it really exist? We're not entirely sure. DHEA is produced by the adrenal gland. There are no receptors for DHEA. So taking it is relatively useless. It has to convert into estrogen or testosterone to have its effect. So it's like taking a hormone and you're not sure which way it's going to go. Is it going to go male or female on you? In women it tends to go male, in men it tends to go female. So it depends on you. So this is what's happening, and that's why you feel so out of control.